The bill to amend the Medical Act will put into effect the announcement last year that the post of CEO was being abolished, a move which drew criticism from both the opposition and Unite the Union.
Following clinical advice, I had sat down with many members of the GHA to ask them how they felt about management and how we would better the management of the GHA. And the resounding advice I received was that it made sense at every level for the top person at the GHA to be a senior consultant level clinician who has the experience in patient care and who would therefore be best suited to be able to guide an organisation as big as the GHA, which has primary care, tertiary referrals, secondary care and mental health care at the very top.
The majority of the CEO's current functions and duties will be carried out by the newly appointed medical director, a post that will now be defined in statute as a result of the bill.
The medical director post was nebulous to the extent that it wasn't defined in statute. So we are now defining statutorily the functions of the medical director. And within those functions, he will undertake the duties rather, of the former CEO, but he is also assisted by a new position, which is the post of Deputy Medical Director, which is also being defined within the new bill, and that would also set out how the management structure and the clear reporting lines between clinicians on the one hand, where we all agree should be led by a clinician, and then the other areas, estates, front of house, catering, all of the other areas that do not fall within the clinical umbrella, then has a clear reporting line to the hospital manager.
The medical director will become the chairman of the GHA board and will work together with management to drive the health authority forward. Although there's been no board meeting since last year.
The next meeting is taking place in June. It has been unfortunate that the board meeting dates had clashed with other exercises, and it meant that the management personnel could not attend. It was just a case of bad luck, but the board will meet in June.
The bill to amend the Medical Act also includes changes to the structure of management posts and provides for such restructures to be undertaken through secondary legislation rather than through bills. Responsibility for elderly residential care will also be transferred from the care agency to the GHA.